Hello and good evening. I'm Melisa Idris.
And I'm Sharaad, Kuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Now, last week, Director General of Health, Datuk Noor Hisham Abdullah Dr. Noor Hisham Abdullah said that Malaysia had succeeded in flattening the curve and is now in the recovery phase of the fight against the COVID-19 pandemic. However, there are other experts who disagree. Joining us on the show is one of those people. He is Datuk Dr. Amar Singh, Senior Consultant Paediatrician and retired from the Ministry of Health. Amar, welcome to the show. It's good to have you here.
Thank you. Glad to be here.
Thank you for joining us. Now, Amar, you argue that Malaysia is not ready to lift the MCO. In fact, you say that there are still many issues that need to be addressed before we can do so. Can you begin by helping us make sense of how this argument, your argument, jives with that of what DG Hisham has said, that Malaysia is in the recovery phase, that the fact is we have recorded double-digit cases for the past week or so, and that is a good thing. So how does that jive?
I think that, of course, our DG Hisham is right, and our numbers are coming down, but we must remember that we are not finished with this pandemic. We're just starting out. If you can see slide 1, you see that I made a comment that what we've done with the MCO, with this restriction order, is that we've actually pushed our pandemic further down. We bought time for ourselves. We've dealt with this current wave and brought it down, and we've bought time to set up our health services in a greater measure. We bought time to train the public and prepare ourselves. But we're just starting out this pandemic. If you listen to everybody in the world, they say we're going to go in for perhaps a year or two into this pandemic. And so I think that what many Malaysians don't recognize is that we now need to be ready for the second wave. And that second wave is going to happen when we lift our MCO. If you look at the second slide, which is a slide coming from the Lancet shows this peak and then a reduction in the peak, which we are doing very successfully. We're bringing the peak down. But if you look at the third slide, the Lancet very clearly shows that actually there is going to be a second wave coming. When you release your MCO, people's behavior is not up to the mark if we don't put in all the right steps. But I think the Lancet diagram is inadequate. If you look at the fourth slide, you'll see my diagram on top of the Lancet diagram showing that we have an enormous second wave. And many people are worried that the second wave might actually be bigger than the first wave, because now we're talking about spread within our own country, not from visitors from elsewhere. It is actually embedded in our community. There's another diagram.
Can I interject at this point and ask you to help us understand, with your projections and with your sense of what this larger second wave might be, are we prepared? Have we bought that, with that time we bought, did we prepare ourselves for a bigger second wave?
I think that we've done some amount of preparation. We've ramped up some amount of the health services. We've actually tried to educate our public to some degree, but I'm not sure that we've got the message across in a major way into the public. I think that a lot of the public is still in a state of disbelief. Some of them actually are ready, of course, but some of them actually think that with the numbers coming down, that we're going to go back to where the way we were before. But that's not true, of course. We have to go back to a very different lifestyle. So my major concern and worry is not so much the Ministry of Health or the government, but whether the public is ready for the release of MCO in preparedness of their lives. Yeah. Right. If you look at the fifth figure, just to finish up, I apologize. You look at some work from Matt and Zin Benson. Matt Benson works with Pink City in Malaysia, and he's drawn this lovely diagram of waves coming our way. And with each wave, we'll have to actually put in more stringent measures. So I think most of the world recognizes that we're going in this direction.
Okay. Can I get you to clarify, Amar, why you argue that the second wave is going to be bigger? And talk us through the idea of community spread, because the first wave was really about the virus coming from people coming into the country. But now you're talking about community spread, and that could cause a bigger wave?
Okay, so if you look at slide 6, I talk about community spread as happening, and community spread is not linked primarily to the clusters. Right now, we're doing targeted screening, focusing on clusters. Now, I think the Malaysian public are all looking at the clusters. But if you look at slide 7 looks at Ministry of Health data looking at surveillance. Now, Ministry of Health is very good at doing surveillance. They do surveillance for 2 areas. One is for ILI, which is influenza-like illness, something that looks like COVID. And secondly is SARI, which are severe acute respiratory infections, which are the severe COVID-like infections. And they do this in about 13 hospitals for ILI, 8 hospitals for SARI. So these are people at random throughout the community being found who just come with an illness and we find that they're COVID positive. Now, if we screen every ILI and every SARI in the country, which are thousands, can you imagine the number of those people that we would have in the community found with COVID positive? Right now, we're only doing sentinel sites, which means a few sites chosen. So this is very clear that we have community spread going on. If you look at slide 8, I've also shown data from the Selangor government, which is now doing random testing in the community. Now, the last about 3,000 that they have tested, they found about 7 people. They targeted people who are slightly older and maybe a little bit ill, and they found 7 people, again suggesting that it's unlinked people in the community.
Amar, is this just the natural way a pandemic progresses? I mean, once we've closed our borders, is it to be expected that the next phase of the pandemic spread or the chain of infection is through community spread? Isn't this anticipated?
Not just community spread, it's also going to be coming from outside. If you look at also that slide 8, you'll see also that there's data presented by MOH yesterday showing that 1% of those returning from overseas are also COVID positive. So we're still going to get reinfected from people coming back from overseas, especially from countries like Indonesia, for example, where the epidemic is growing rapidly. We also have a very large migrant worker population, maybe 5 to 7 million. And we recently shown that quite a number of them are also infected. And then we can anticipate that when we go back to work, when our migrant population go back to work, then there's going to be spread. So a lot of this is asymptomatic spread. People who don't show much signs but are spreading the virus.
I want to understand, some of the reports, because now everybody's reading about not just the Malaysian situation, but also the global situation, the spread of influenza in especially temperate climates where they have several waves often. Does Malaysia actually experience that kind of influenza seasons? Do we have waves and is it reported at all?
I've seen some data from UMMC, University of Malaysia, showing some seasonal trends now in influenza, especially with our wetter months. But we don't have that sharp kind of trend that Caucasian countries have with winter. In fact, they're quite hoping that with their summer months now that COVID-19 will drop. But I think those of us who are in hot countries, and if you look at Australia as well, which is not really in winter right now, but in summer, I don't think heat seems to touch this virus very much. Yeah. But I do expect that certain times that there will be a higher rate of coronavirus than other times.
All right, we're going to take a quick break. Dr. Amar, we're going to come back and continue this conversation with you in just a couple of minutes. Stay tuned to Consider This.